So
I'm ready.
this
I
is-
just didn't know if our clocks were synced here. Anyway, well, good morning, everyone. I am delighted to see you. Actually, I don't see anyone but Megan and myself because we're in a webinar format, but I'm delighted to know that you are here. And that for those of you who came back, thank you for doing that. And you'll see in a little bit when I talk about a little more about gratitude, why I am especially grateful for you. But before we go there, I just want to remind you that I asked you last week to please go online and to take the Authentic Happiness Survey at the website that I provided. And I invited you to begin keeping a gratitude journal. Because we know, based on good, solid social science evidence, that writing a gratitude journal actually, over time, and by over time, I mean over a week or so, not over years and decades, can significantly improve our happiness quotient. And remember, psychologists define happiness as subjective well-being. I told you when I introduced the idea of the gratitude journal that you needed to be specific, that it wasn't enough to simply say, I'm grateful for my dog. Here's my dog, Winton. But you needed to say a little bit about why. Well, as you can see from this slide, Winton, who is a standard poodle and who is used to being groomed, has not been groomed in about 3 months, given the pandemic and the closures. So he is now wearing a dogman bun. You can see it up there at the top of his head. And every time I do his dogman bun in the morning, I laugh. And I'm grateful for my beloved pet because he's such a great source of laughter and indeed comfort. I hope you have a Winton of some sort in your life. Let me quickly run through what we're going to talk about today. We're going to begin by talking about resilience, tiny little bit of the history of the construct in the social sciences. We're then going to talk about challenge. We'll go on to talk about loss, and loss always involves grief and mourning. We will then talk briefly about the stages of grief. And we will talk about a new construct that Kubler-Ross's protege has added to the 5 stages. It's stage number 6, finding meaning. We'll talk a little more about gratitude, but you've seen the only slides you're going to see of Winton today. We'll talk about the kinds of resources that we need to face challenge, and I'll talk about 2 different internal resources, grit and optimism, pessimism. And then we'll spend the latter part of the class focusing on another tool that I want to share with you for your use at home or as you begin to move around the community in limited ways: self-compassion and self-care. And finally, we'll look at some ways to take better care of yourselves. Because there's only one of you, and you definitely deserve it. So now I just want to give you a graphic representation of the model that Jeanette Ickovics and I introduced in a paper that was published quite a long time ago about resilience in the face of adversity. And this is an old slide, and that level line of functioning on the axis where you see level of functioning, the solid line that leads to the down arrow, that is the occurrence of the challenge, really ought to be, not to be a straight line, but it ought to be a wavy line, indicating that our typical level of functioning, no matter who we are, is a little up, a little down, a little up, a little down. It's certainly almost never just a straight line. And then a challenge occurs. And that challenge can be virtually anything. But it's got to be something that focuses our attention and that causes an immediate decrement. And so when you look at that decrement, you see a plunge from functioning as usual to the lowest point. And depending on what that challenge is, it inevitably involves a sense of loss, of grief, of pain. And it's important to understand, as I said, that loss is associated with any challenge that results in a significant change in health, in lifestyles, in relationships, in financial status. And what we're facing right now for many of us has resulted in losses in a number of those domains. And as we'll see as we move along today, it's important to acknowledge and name the pain that occurs in the face of the loss. And in naming it, we can then allow ourselves to grieve it. I'm going to quickly go back to the model, because here you see the challenge, you see the decrement, that dip downward at the arrow, and then you see three possibilities. Now, actually, of course, there's a fourth possibility, and that is a failure to even survive. And that would be a fourth line under A that would decline. But usually there's survival. And of course, in the face of challenge, and everybody's challenge is different, it may be that some people just survive. They don't get beyond that lower level of functioning. The second line that you see labeled B is resilience. And resilience is commonly viewed as a homeostatic construct. And I gave you the example last week of resilience being something that has a form and then is stretched, and then when you let go again, resumes its original homeostatic form. So we're going to talk for a moment about the construct resilience, and in the social sciences, its history. Emily Warner and her colleague published a book in 1982 in which they detailed a longitudinal study that began in 1955 on the island of Kauai. They studied 700 children on the island of Kauai who were born in the mid-50s, the year 1955, and they followed them, although they lost some along the way, both because they were out of contact, but also, of course, accidents and illnesses and other things. But the bulk of these individuals were followed for decades, approximately 30 years. And what they were looking for was resilience in the face of adversity. And the 700 children that they studied were children who were at risk because of the circumstances of their births for later difficulties, because they were poor, because they came from families who were not functional, etc. And over those 30 years, they identified a subset of individuals who they labeled resilient. And out of that study, they obtained information about 4 factors that 10% of those children whom they labeled resilient, that would have been 70, shared. The first was an active approach to solving life's problems. So these were kids and later teenagers and then later adults who actively tried to confront problems and move forward in efforts to solve them. Another way to think about that is they were kids who had a high degree of belief in their own self-efficacy. They thought they had within themselves what it took to come up with a solution to whatever problem it was that they faced. They also shared a tendency to see their life experiences constructively. And you'll see in a little bit when we talk about optimism that that indeed is one of the characteristics of optimism. Marty Seligman had not done his work on optimism when the Warner Smith study began. So that construct wasn't out there. But today we would probably label these children, and then as they move through their lifespan, later adults, as optimistic kids. They also had the ability to gain the positive attention of other people. And ever since I read the Warner and Smith book about this longitudinal study, I've been struck by that. they actually labeled these children attractive. But they didn't mean that these 70 kids were pretty children or handsome children. What they really meant in the use of that term attractive was that there was something about them and the way they presented themselves that resulted in others reaching out to them. They were winsome, or they were amusing, if you will, and they were amazingly tenacious. These children made bids to engage other people in their lives when they had need for assistance. And when those bids were rejected, and sometimes they were, because the adult they reached out to was too busy or too involved in other things or distracted or unwilling, they didn't withdraw. They just went on to the next person. And so, because of that persistence, they got what they needed, even if it took numerous false starts to get there. And if you read the Warner and Smith book, they talk about these kids being the children of poverty, whose parents were not functional, perhaps one parent and siblings in jail, another having substance abuse problems. These were kids that you would say didn't have a very high probability of life success, who, because of these 4 characteristics, over decades turned out to have a significant amount of life success despite long odds. And the 4th characteristic that they identified common to these resilient children was the ability to maintain a positive view of a meaningful life. So if you will now just think back to the model with A, B, C, we've been talking about the B line, which is a return approximately to where the person facing challenge was before the challenge occurred. But there was another line above that, which was labeled C, and that's thriving. I'm not going to talk a lot about thriving today, but I will talk about it in our 4th class when we consider the silver linings that may come out of our shared loss in the face of this pandemic. But I just do want to tell you that thriving, which is a value-added construct, doesn't bring us back to the place where we started before the challenge. In fact, the challenge, because we are able to marshal both our individual and social resources, provides the impetus to take us beyond where we were pre-challenge and to grow or to thrive. Whoops, sorry, wrong button. So it provides the impetus to thrive. And in order to thrive, we, as I said, marshal our personal resources, Our dispositions, another word for that is our personality traits or characteristics. Our biology, and there's a little hereditary piece in that, and our cognitions, or our thoughts, our cognitive take on the world. And cognitions can be changed through learning. We can learn, for example, to be more optimistic. And that's one of the tenets of cognitive behavioral therapy, to change your perspective. I love to show the pictures of the people responsible for constructs. So here we have Robert Kahn, who in 1991 defined resilience as the ability to recover quickly and completely from misfortune or challenge. He didn't talk about taking it to the next step of thriving, but he did talk about rapid recovery. Thriving is transformative. To thrive, we have to make a fundamental cognitive shift in our response to challenge. And it's so important to underscore for all of us the acknowledgement that one person's profound challenge is not necessarily another's. And we'll talk again when we talk about grieving, about judgment, but we all must be careful about trivializing someone who reaches out to tell us that they have experienced a kind of adversity that we would not categorize as profound. As I said earlier, thriving requires us to effectively mobilize resources, our individual resources and our social resources. And the challenge itself provides opportunity for change because it forces us to confront our personal priorities. It forces us to re-examine our sense of ourselves, of who we are. It maybe does that because it forces a change in our roles. It might result in the acquisition of a new role. We may go from being single to partnered. It might result in the loss, and that can be challenging, by the way. It might result in the loss of an old role. Very often, the loss of spouse, of course, results in the loss of role of husband or of wife. It may result in the reordering of old priorities. Our career might have been the most significant thing, and then suddenly we are challenged and realize that maybe career is not as important as personal relationships. There are many, many challenges that we can all think of. I'm sure each of you has your own list that can alter our social roles. Just a couple of examples. I referred earlier to the role of widow or widower, And depending on the culture in which you live, those challenges may be more or less overwhelming in terms of the social context in which the challenge occurs. The loss is a loss no matter what culture you happen to be embedded in, but it takes on different forms depending on that culture. So, for example, and I referred to the fact that I'd spent I have spent a great deal of time in my career in South Asia. In Nepal, in the Nepalese culture, the Nepalese word for widow is boksi. And boksi means witch. And it is culturally believed among people who are not well educated in a Western tradition, and that is many, many people in that country, which is in the developing world, as you know. It is believed that if you look upon a widowed woman, and you yourself will be the next to be widowed. Talk about isolation, talk about being ostracized by your surrounding social group. And there are lots of other things that in that culture that go along with that social rejection. People know who you are because you're no longer allowed as a widow to dress in bright colors. You must always wear either gray or white because your life, now that you are spouseless, is no longer to have color in it. And you are no longer allowed to attend festivals or happy ritual happenings. You cannot attend the weddings, for example, of your adult children, and you can't even enjoy delicious, spicy food because you ought no longer enjoy pleasure. That's a big loss on a lot of dimensions, isn't it? There's the role of retiree. Another loss of previous roles and maybe the embrace. Apparently that's true here because now your full-time job, according to this visual, is enjoying yourself in the sun and taking it easy. So let's turn and talk about loss, because challenge, as I said, regardless of what it is, always involves loss. And we define loss as the state or the feeling of grief when we're deprived of someone or something. And the loss, of course, can take many forms. We talked a minute ago about loss of a career in retirement, loss of spouse when one is bereaved. It could also result in from loss of child, even loss of respect as your social status changes. What are we facing in terms of loss today in light of this COVID-19 pandemic? Well, one of the things, of course, that we are facing is the loss of physical connection. I don't know how many of you read the Berkshire Eagle. I was struck, I think on Saturday, there was a little tiny feature slash human interest story in which there were a couple of lines where somebody had asked Prince Charles, who was sheltering in place, what he missed the most. And he said he missed hugs the most from his extended family and friends. And I think a lot of us miss that human contact. And we have Zoom, we can see each other, but it's not quite the same. And I think this might be a good time to just reflect for a minute, again, culturally, however, on this question of our adaptability and the meaning of human contact. It's 2020. We live in a Western culture in which shaking hands, the comfort of touch, and hugging have been widely embraced, no pun intended, and we freely engage in that kind of tactile connection. Well, I grew up here in the Berkshires in the 40s and 50s, and it was a different time in many ways. Not just because General Electric was the primary employer. And one of the cultural ways in which it was different was that it was a culture typical of New England, especially the farther north you went, which was not very demonstrative. And so one of the things I learned growing up was that it was considered impolite and socially inappropriate to make eye contact with strangers. Now, that didn't mean you couldn't look at somebody else when you passed them on the street, somebody else you didn't know, but you weren't supposed to do it directly right in their face because that was staring, and staring's intrusive. And that was just part of the norms of my Western New England upbringing. And when I was 18, I went off to college in Western Pennsylvania. And about a week after I arrived on campus, I had to run an errand into what we would now call a convenience store. And I was walking down the sidewalk after class and kind of mid-morning, going off campus. And a man passed me on the sidewalk coming the other way. An older man who, of course, I didn't know. I was in a different state, residing in an entirely new place. He looked me full in the face, nodded his head, and said, "Good morning." And I was shocked because the norms in the place that I grew up suggested that that was not appropriate behavior, but very intrusive, and I was a little frightened. Well, then, many, many decades later, I moved to the South where everybody hugs everybody, and that took some getting used to as well. I share this with you just to remind all of us that we are amazingly adaptive. And if it becomes important in order to protect ourselves and others, to continue to take certain kinds of measures, such as not touching directly, we will be able to adapt to that. It will be a loss in the beginning, but over time, it will come to have a different significance. Remember the first time you saw somebody sneeze into their elbow? I remember the first time I saw that. It's now a long time ago. I think nothing of it today other than gratitude that somebody's protecting me from germs. But the first time I saw it, and I hadn't been aware that it was a new public health mandate, quote unquote, it kind of looked like the person was wiping their nose on their shirt. We are very adaptable, and that's a good thing. Loss of job. I just put this up to remind us of the employment impact by state of this pandemic. Now, this is out of date by a little over 7 weeks, but we can see that the immediate worst impact was very far from us in the state of Washington. Loss of function, another kind of loss, of course. But let me share a silver lining with you. Studies have been done of people who have suffered, I put that in quotes, profound challenge, such as loss of function, physical function, paralysis, perhaps, because of health challenges. And the immediate response, not surprisingly, is a decrement, a dip, a sense of, I don't know if I want to go on, I don't know if I can live in this way. But if you follow people who have faced those kinds of challenges for 2 years, you find that at the end of that time period, in terms of their outlook on the world, psychologically, many of them, about 70% of them, have been resilient and are doing about as well, psychologically speaking, as they were before the major challenge occurred. Grief is a normal reaction to loss. And we're all grieving the losses that the pandemic has caused us to suffer. And it's not just been, for many of us, a single loss, but there have been multiple losses: loss of physical contact, financial security, loss of job, loss of a sense of safety as we had come to understand it. Worry about loved ones, changes in routines, loss of events that we were counting on participating in, loss of our regular, normalized understanding of the world we live in. And here are some of the individual reactions that are normal in response to the grief of loss. Trouble focusing on normal tasks. Sleep disturbance, and of course that can come in several different packages. Too much or too little. Feelings of anger or irritability. I don't know about you all, but I've certainly been more irritable than in the last 3 months than perhaps I usually am, or at least I'm more aware of it. I guess you'd have to ask Kirk to know for sure. I think I won't ask him right now. Physical feelings, headaches, upset stomachs, fatigue or low energy, re-experiencing a past grief. This past week, as I was putting these slides together, I was taking a quick look at some of the recent literature, and I came across re-experiencing past grief as one of the normal reactions to loss. And it really kind of caught me up short, because since the pandemic began, I have been aware of dwelling in a way that I haven't done in a long time of some past experiences of grief over loss of my own, in my own life. And I thought, aha, now I get it. And then there are attempts to modulate our own anxiety by distracting ourselves, overeating, over drinking. We can't do over person-to-person shopping, but we sure can get online. And then, of course, avoidance, avoiding or trying to avoid thinking about the situation by distracting ourselves in a variety of ways. Grief is the feeling you have in reaction to loss. Bereavement, and I just want to draw that distinction for you, is the state of experiencing the loss. And then, not surprisingly, many of us, as we look toward the future, are having anticipatory grief because we're worrying about greater loss of some unknown variety that may be yet to come. And of course, some of that comes in the focus of concerns about resurgence of the pandemic. Mourning is the outward expression of grief. And for many, that has been a great difficulty in this time of physical distancing and social isolation, because we haven't been able to engage in the quote normal rituals in our culture of bidding loved ones who have died goodbye. And when I thought of illustrating that fact, I thought maybe it would be useful to remind us again of some of the cultural differences in those rituals. So here we have a depiction of Hindu kind of mourning, where the body of the deceased is burned on the banks of the river so that the ashes will ultimately end up in the Ganges, which is viewed as a holy river in India. And that is done, of course, by cremation. So, and also very important ritual, a lot of rules around it, etc. Many of you, I'm sure, are familiar with Elizabeth Kubler-Ross's work on the 5 stages of bereavement. And here is her protege and colleague, David Kessler. They worked together, in fact, wrote one book together before her death in 2004. His work as a bereavement counselor, grief expert has continued. In 1969, Elizabeth Kubler-Ross gave us what is known as DABDA, the 5 stages of grief. And let me just quickly name them for you. Denial, anger, bargaining, depression, and acceptance. After Kubler-Ross named and described these 5 stages, controversy emerged within the psychological community, and by that both psychologists, social workers, and psychiatrists, I'm defining that broadly, about whether or not there were really 5 stages, or maybe more than 5 stages, maybe 7 stages. And that continues in some sectors to be a professional controversy. But what I want to underscore, which is something that Kubler-Ross tried mightily to underscore, but was often ignored, she never intended to suggest that the stages were linear. She didn't mean first you deny, then you get angry, then you bargain, then you get depressed, and finally you accept. She intended these stages to be descriptive, not prescriptive. These stages are a scaffold to kind of hang our understanding of grief on. And those of you who have experienced profound grief from loss know that in the beginning, perhaps you experience denial, and then very quickly it switches to anger, and then you start to bargain. You know, if the outcome is better than I fear, then I will never again do X. You may swing into depression and finally acceptance. David Kessler, Kubler-Ross's protege, provided us fairly recently with a 6th stage of grief, because years after beginning to do his work in bereavement, he himself faced the loss of his 21-year-old son, who was the younger of his 2 sons. And out of that personal experience, not right away, of course, but a number of years later, came a new understanding on his part that acceptance is really not enough, not the end of the process, but rather there's an additional stage which involves finding meaning. And he was heavily influenced by Viktor Frankl's famous work, Man's Search for Meaning, in his thinking about that. And he's now written extensively about that final stage. And by the way, when I say final stage, that is not to suggest that one ever puts the grief totally aside. It's not, we talk about closure. Well, it becomes, the best way I've ever had to explain to others, in the beginning when you face loss, it fills you up. It's all you feel. Let's say it's loss from the death of a loved one. And over time, you are no longer feeling only that loss. It becomes smaller and smaller, so that what was once the size of a watermelon over time becomes the size of an almond. But it never totally dissipates, and you never know when it's going to come front and center again either. Now all of us are grieving the collective loss of the world we knew. And in fact, maybe we didn't exactly know what we had until it was gone. So we are having to experience our reactions to this loss and find meaning in those reactions. And I just want to remind you, and I don't mean finding meaning in the loss itself. We'll talk in a minute. We find the meaning in what comes after that loss. But before we get there, if we don't name it, it's very hard to feel it. And we must feel the grief. And for each of us, the worst loss is our loss, whatever that loss may be. There's a tendency on the part of us humans to try to compare our losses and say, well, mine is worse than yours, or alternately, how dare I feel so badly in the face of this loss because look at so-and-so, his or her loss was worse. No, the worst loss is your loss. Whether that's loss of person-to-person education, the loss of a summer in the shed at Tanglewood, the loss of Inside Out at Jacob's Pillow, the loss of sitting in the stands to see your favorite sports competition, the loss of play dates, or the loss of a trip to your groomer. It's your loss and your reaction to it. we all have to remember that our feelings are valid, whatever those feelings may be. And part of remembering that when we interact with others, whether it's person to person or over Zoom or over the phone or some other way, because everyone's loss is theirs, not ours, we have to be careful about judging the meaning of that loss. Judgment demands punishment. I read David Kessler's book about the 6th stage of grief in this last week. And not only does he talk about this additional stage of finding meaning, but he points out that one of the common results of grief for couples who lose a child is the dissolution of the marriage. And people are very quick to say, oh yes, loss of children causes divorce. But what he observes is, wait a minute, it wasn't perhaps the loss of the child that triggered the dissolution of the relationship, but rather the judgment that the couple engaged in about who was grieving the loss the right way. And he concludes that observation suggesting that two people with empty tanks can't fill one another. He also suggests that we can't pole vault out of pain. If you don't feel it, you can't heal it. As I alluded to earlier, the meaning is not in the crisis itself. The loss, and sometimes we hear people talk that way, you know, the loss was a blessing. The loss is not a blessing. The meaning is what we do after the crisis. And we should remember that life gives not only great joy, but great sorrow. A very Buddhist notion, of course. Suffering happens, just happens. And so, say, folding our hands in respect instead of hugging may be the new normal because of this thing that just happened. Oh yes, we need to find out why it happened. We need to find out how to control it. We need to find a vaccine for COVID-19. But playing the blame game is not very useful. I said we'd come back to talk a little bit about gratitude. Very early on facing loss, it's a really hard time to find gratitude. But what you can look for instead are little tiny wins. So if it's been the loss of a child, a little win might be acknowledging that, yes, you're very distressed and distracted and you're grieving, but it's a little win that you're still putting dinner on the table for the other members of the family. Looking for little things like that. But over time, there does become a point where gratitude can appear. And I was struck in reading David Kessler's book. What he says about this is that over time, he became grateful in a very profound way for the 21 years that he had to spend with his son, David, in this lifetime. Different way to look at things, of course. We're going to turn now to look at a couple of just two individual resources. One having to do with grit, which the G is for growth, the R for resilience, the I for integrity, the T for tenacity, and a cognitive or thought-based or belief-based perspective on life, optimism versus pessimism. Two glasses side by side, depending on your view. The one on the left may be half full, the one on the right half empty. Optimism versus pessimism. But first, let's look at Duckworth's notion of grit. She defines grit as passion and perseverance for long-term and meaningful goals. And grit's important because it's a driver of achievement and success, independent of and beyond what talent and intelligence contribute. Which doesn't mean to say they're not important. She just defines grit as extra. Couldn't resist. Iconic representation of John Wayne in True Grit. Duckworth identifies 5 characteristics of grit: courage, conscientiousness, which involves being achievement-oriented rather than dependable, and long-term goals, and endurance, which is kind of a follow-through notion, resilience, which in her view is a 3-part characteristic involving optimism, confidence, and creativity. And aren't we seeing resilience all around us right now in our community with the extraordinary creativity of the cultural institutions as they continue to reach out to engage us? Barrington Stage preparing to, because they can't bring the planned production of South Pacific to the main stage, they're working on finding ways to bring an orchestra to an outside venue in the late summer to play the score from the musical. And of course, they're planning to reschedule South Pacific for 2021. Just another example of creativity. And finally, excellence is a characteristic, according to Duckworth, of grit. Excellence, not perfection, but excellence. And here is my colleague, Martin Seligman, University of Pennsylvania, fellow social psychologist. No, I'm sorry, he's not. He was trained as a clinician, but a lot of his work has been so important in social psychology that I misplaced him in the pantheon of subspecialties. He's a professor at the University of Pennsylvania and a past president of the American Psychological Association and a pioneer in the field of positive psychology and the author of a number of books, including Authentic Happiness and The Optimistic Child. If you took the Authentic Happiness survey that I suggested you take last week, that work was done under his direction. So, optimists versus pessimists. Well, whether you're optimistic or pessimistic depends on your explanatory style. That means the style that you prefer to explain the events that happen around you or to you. Your mother and your teachers, we know from now, 35 years of research, have the most influence on your explanatory style. And pessimists have a tendency to personalize bad events and attribute them to permanent, pervasive causes. What can you expect? The world is a bad place, a difficult place. But when good things happen to them, they ascribe the good things to something temporary, something impersonal, something very specific to that single event, as opposed to something they can count on. And when we project a despair that we feel in the present into the future, surprise, surprise, it results in a sense of hopelessness. But in contrast to that, optimists externalize the cause of adversity and see that cause as temporary or fleeting and very specific to that particular adverse circumstance. They credit positive events to personal, permanent causes. The world's a good place, a benign place, etc. Two very, very different world views. Optimists are a lot quicker than pessimists to get over setbacks and try again, because they think it was the setback was occasioned by a single episode. Remember the Frank Sinatra lyric, take a deep breath, pick yourself up, dust yourself off, and start all over again. As a special gift, I didn't try to sing it to you. That would not have been pretty. Pessimists have one advantage over optimists. Pessimists are more realistic than optimists in assessing their situation. Optimists view the world through, if not rose pink glasses, glasses that are tinted rose. And because of that, optimists tend to exaggerate the control they have over the events around them. Whereas pessimists, or pessimism, is a reliable predictor of depression. And I don't want to dwell on this. I just want to note that there are three major sources of depression. One is a greater emphasis on the individual. Another, the erosion of shared social experiences. And finally, a priority within the individual on self-esteem. However, here's the good news. Resilience comes down to explanations we give ourselves about why certain events occur and what causes them, but we can change our outlook. Pessimists tend to use words like always and never. Things never go right for me. I always lose whatever, my social circle, etc. In contrast, optimists isolate the troubling event and they don't see it as a permanent characteristic that will go on until their last day on earth. As we know, there are health implications for these kinds of worldviews. There's a connection between learned helplessness, for example, and the ability to fight cancer. Being optimistic won't cure you, but there's good data that suggests that optimists are more readily able to mobilize their immune systems when they are getting treatment, and it results in a longer lifespan, which doesn't mean they are saved. In contrast, learned helplessness and depression actually erode the effectiveness of the immune system. And so it's important to think of ways to break the cycle of pessimism. How can we do that? Well, we can do it by distraction or refocusing attention. For example, refocusing an emphasis on me and my situation to an emphasis on the common good. And I think we're seeing that on the part of a lot of people in the face of the pandemic. We can challenge our negative thoughts. Okay, I mean, we have the ability to say, wait a minute, is that really true? And we can have a knockdown, drag out argument with ourselves, disputing negative beliefs. Okay, I now want to spend the next minutes that we have with each other taking a look at a tool that I hope you will find useful in the coming weeks to increase your self-compassion by engaging in self-care. Self-compassion involves valuing yourself. And when we value ourselves, we're motivated to take good care. Good care can come in a variety of ways: awareness of who we are, being kind to ourselves, making good choices for ourselves in terms of eating and sleeping, etc., seeking support, doing things that are fun, laughing. But it's a deliberate series of actions: mental, emotional, and physical. The key to self-care involves improving our mood, reducing anxiety, and it will boost not only our relationship with ourselves, but our relationship with others. And I just told you earlier that I've been a bit irritable. And now that I'm saying this, in the back of my mind, I'm reflecting on the possibility that maybe I haven't been paying enough attention to self-care. Compassion literally means to suffer with. That's compassion. And when we're compassionate, our hearts expand. We have a sense of warmth and caring, and we're able to offer understanding and kindness to other people and to us. Suffering is a part of human experience, but it's not the only part. Kristen Neff, who is a psychologist and who works out of the Center for Good Science at Berkeley. And that's good science, not in the sense of science well done, but science in the service of a good life, has a number of suggestions for taking a self-compassion break. And I want to share those with you now. 1, focus on something you find difficult or stressful, like maybe helping your children or grandchildren with their schoolwork, as many of them have been doing assignments remotely. Focus on something difficult and then let yourself feel the stress in your body. Remember, you have to feel it and name it to heal it. So number 3, name that feeling. Say to yourself, this is a moment of suffering or pain. And then reflect on the fact that suffering is a part of life. And then put your hands over your heart. Take a deep breath and say to yourself, may I be kind to myself today. Here are some ways to take better care of yourself. Know who you are, and that involves knowing what your limits are. Get the sleep you need and know how to rest, which means turning off the television set and other distractions, turning off the lights, etc. Eat well. Find ways to work that reduce stress. Look around, identify what you enjoy, and build some of that enjoyment, even if it's just a little bit, into every day. Reflect on your triggers. Once we know what upsets us or what takes us down, it's an awful lot easier to avoid doing whatever that might be. And remember, there's only one of you. Appreciate that one. And finally, and I think this is one of my favorites, make a no list. Make a list of the things you no longer like or want to do and follow it. Self-care takes practice. And if you practice self-care this coming week, it just might be one of the things you feel grateful for. And if that's true, write it in your gratitude journal. I hope you're keeping one. And finally, laugh. Just find something that amuses you and let it all go. Laugh. Like almost everything, self-care takes practice. Start practicing right now. Megan, do we have some questions?
We do indeed. Our first question is from an anonymous attendee. They say, can a person thrive in the absence of challenge?
That's a fascinating question because we see the challenge as providing the jumping off spot for thriving to occur. I mean, I think a person can be content. I think a person can be doing well. That is a very profound question. I'm going to thank you for that question, Anonymous. I know many people that I think are thriving individuals. I don't know anybody who's never faced a challenge. So it's really hard for me to parse that out. But I'm going to give it some thought, and I'm going to be coming back next week and at least comment on it.
That's great. Thank you, Ginny. Another anonymous question, and it's from about a half hour into your presentation. So it was when you were talking about widowed women, and the question was, does that happen to widowed men also, or only the women? So it was in the context of what we.
Somebody is very culturally astute, and I'm sad to tell you that in South Asian cultures, As I'm sure you probably know, men are more valued than women. And the answer is no. A widowed woman, for example, in Nepal, will never remarry. That is considered, she's damaged goods. I mean, she's boxy, she's a witch. However, a widowed man may find himself remarried very quickly. There are no cultural prohibitions. He is not considered to be somehow scarred by the experience. He can go to festivals, eat spicy foods, wear whatever he wishes.
Interesting. We also have a question from Linda Friedman, and she asks, what is the difference between anxiety and anticipation of grief?
Well, it's really hard to parse those two things, because anticipatory grief gives rise to anxiety. That's one of the physiological manifestations which we label anxiety. It's that anxiety and fear on a continuum. They involve increased heart rate, the beginnings, cortisol release into the brain, preparation for fight or flight. When it's anxiety, it's kind of a lesser level than when it's fear. And the anticipation, cognitively, we can trigger, with our thoughts, that physiological response. It's usually a lesser in degree than it would be if we were confronting the reality of that thing that we fear, for instance. But we can certainly conjure it up and react.
Thank you. And Lee Easter asks, what would be a good book that conveys what you said today in words a non-professional might understand?
Did I use too much jargon?
And maybe he wants to give it to someone, a friend.
Someone else, of course. I try to be mindful. That's why, psychologists are kind of like attorneys, we get very enamored of our of our strange labels for things. Gosh, I found David Kessler's book that I mentioned very, very accessible. Let me put together a short list and make a slide and share it with you all next week of, very accessible books for.
That sounds wonderful. And finally, Nancy writes, just points out that there's a medical diagnosis called failure to thrive.
Oh, yes.
Then, yes, Drew.
That is not miasma. Mm-hmm. It's been with us for a very, very long time. Developmental psychology, it goes, I'm thinking back into the 40s when children who were orphaned were often put in institutions where there were not sufficient staff nor sufficient understanding that human touch was critical to development. And it was called, the label for it was miasma, or it translated, another term for it is failure to thrive. And indeed, and the use of thriving in the context that I am using it is different, but the notion of growth is the same in both cases.
Great, and perfect timing. It's about 1:30 now.
Whoa!
Thank you, Ginny. If you want to leave any parting words, I will step off the
stage. The only parting word really I have is that I hope you will stay safe, and be well, and write in your gratitude journals, and engage in self-care and self-compassion this week, and maybe write about those efforts in your gratitude journals. And I'll see you next week. Thank you. Thank you for being here.
Thank you.